there are 5 types of enteral feeding. First one, NGT, nasogastric tube, which is a feeding from the nose to the stomach. The second one is the orogastric. It is the feeding from the mouth to the stomach. The third one, the oroenteric. Oroenteric is the feeding from the mouth to the intestine. Fourth is the nasoenteric. It is the feeding from the nose to the intestine. And the fifth one is the PEG tube. PEG tube means, PEG means P is for percutaneous endoscopic gastrotomy. So it is the tube which you connect to the open wound in the abdomen direct to the stomach.
Okay, so why we do the NGT feeding?
Because to provide comfort to the patient and to give nutrients to the patient.
Okay.
And then now we are doing this is the equipment we will be needed for the feeding. This is the kidney basin,
Okay.
a septal syringe, NGT nasogastric tube, stethoscope, sorry nandito kasi. Okay, so before we do the procedure, we should there is a universal protocol. The first one is hand sanitize, hand wash and then sanitize.
Okay.
Okay, the second one, introduce yourself to the patient.
Okay.
And then explain the procedure to the patient that you are going to do feeding to the patient.
Okay.
So the next one, check also this equipment if it's working. And then caps. C is for collect, A is for arrange, P is for prepare, and S is for sanitize. So after that one, we need to secure also the safety of the patient. We need to lock the bed wheel and raise the bed bars for the security of the patient. So if the patient is, you need also to identify the patient now. So if the patient is conscious, you will ask him that his name, complete name, date of birth, and you will check the wrist. There is the complete name and the date of birth of the patient. So if he is unconscious, so you will ask the family member his complete name and the birth date, and check also the ID of the patient. So now we will start the procedure. First one, take the plaster, cut it into 3 pieces like 1 inches each.
Okay. Just enough to cover the nose. Huh?
Yeah, just enough to cover the nose. So you will place this one just near you so that it will be easy for you to take the plaster. So for example here in the bar, or you can put it here in your arms. So 3 pieces, 1 inches. And then the fourth one, around 1.5 or 2 inches you will cut. Okay. You will cut here at the center for the nasal bridge. Okay. Here. Okay. So take the goose. There's another one. Okay. Put lubricant gel. Set aside. And now we will take the NGT. So we will do this one like measuring from the earlobe of the patient to the nose tip of the patient. Okay? And then there is a number indicated on the tube so that it will be easy for you to identify. So if the tube is very long, you need to roll it like twice. Like just leave 4 to 6 inches of it. Okay? Okay. Okay, now we will tell the patient that we will start the procedure to put the tube inside the nose. Okay,
So what you will say to the patient?
Yeah, tell the patient to swallow until the tube will come inside the stomach. So, and then if it's already inside, check the mouth of the patient. If it is coiling, so you need to redo it again. Do it again. Okay. So now it's okay. So we will put a plaster in it. So if it's okay now, it's inside. So we will put a plaster. The first one, this one. This. Okay.
Relax. hindi ka lang mag-ano dito, ano? Little down sana ito.
Little down?
No.
So,
Hindi mo lang basta without anything that extra. Okay.
then the second one, this one, where we cut for the nasal bridge.
Okay.
Do like this, and then
Don't cover here.
ah,
Move down.
Move down?
Ito lang.
okay.
Okay.
Then crisscross.
Kung ano ito, kung hanggang saan ka nag-cut, dun mo siya ilagay.
Okay. So crisscross.
Okay.
So the other. Then the other one, last one at the top. Okay. Okay, that's it. So now there are 3 steps. We will check if it's going inside well. We will take the syringe, 20 ml, 20 of air. Aspirate, 20. Okay. This one pinch, open, and then connect. Side, so we will use the stethoscope. This is the diaphragm. So we will put the diaphragm above or below the navel. So we will put here above the navel.
Baba mo pa. Above the navel lang. Yung puso niya nasaan?
Nandito.
Okay.
Okay. And then, we need to push it hard. So if you will hear a bubbling sound, it means you're in. Okay? So the second one, you will put this one here side in your pocket, the diaphragm. So the second one, second test is aspirate 10. So you will see a yellowish or whitish gastric fluid. So if like this, it is okay. The tube is inside the stomach. So again, we will disconnect the which gastric fluid.
Okay. So,
Okay. Then after we will disconnect,
Okay.
dispose the gastric fluid.
Pinch
Pinch
and
and
close.
close.
Okay.
Then
Set aside.
this one, the gastric fluid, we will dispose in the kidney basin,
Okay.
and then we will separate the plunger.
Okay.
Set aside. The third test, a cup of water. So we will soak this one, and if you see there is bubbles in it, it means it's not okay. So we need to do again the procedure from the number 1.
Okay.
Okay? So assuming it's already okay, so now we will start the feeding.
Okay.
So first, we will do the water flashing.
Hmm.
We will connect this one here, open and pinch, open, and then connect the syringe. So we will put 30 ml of water.
Okay.
So if the water is not going down,
Hmm.
take the plunger, and then you will push it gently.
Okay.
So until the water is going down inside. So there should be water here until here available.
Okay.
So after that one, put this plunger, and then we will start to feed. So if the doctor instruction, order 200 ml, so this is only 50 ml. So we will divide it by 4. So 4 times we will feed the patient. 1, 2, 3, 4. So 200 ml of feeding. So after the feeding, when it finished, it's inside already. Again, water flashing. Before and after feeding, we will do water flashing. So again, 30 ml of water. So now it's okay. We will disconnect this one, pinch, disconnect, and then close.
Okay.
And then set aside. And then the materials, you need to wash the kidney basin, the aseptic syringe, and the remaining, the lubricant gel also you can use after, and then the remaining you can throw in the medical waste.
Okay. If you are going to use it again.
If I will going to use this again, for example this one, this aseptic syringe, I need to cover this one with a gauze, like this, in triangular shape, like this, and then with the plaster. So now we are doing the second feeding. Second feeding is like we have this 1000 ml or 1 liter. So you need to check the name of the patient, complete name, and the expiration date of this one. So this bottle you will take from the fridge. So make sure like 10 minutes before you feed the patient, you need to remove this one and then set aside. Take a towel, set aside. So now it's okay, we will hang this one. And then before we will feed this one, we need to make water flushing also. So we will again pinch, open, and then connect. Then 30 ml of water again. So it's okay now. We flash already water. So again we will take the goose, and then so that it will prevent from the leaking. Okay, set aside this one, put in the proper place. So this one, the bottle, there is like this that you can connect to the machine. So in the machine you will input like 1000 ml, and then according to the doctor's order, for example 200 ml per hour or per minute, like that. So the tip of this one, you can also use this direct. You can connect this one direct here. So for example, this one, I think yeah, it's bigger. So assuming this is the one, because it's bigger, assuming this one you can put direct. So now we'll put the gauze and then connect this one. So okay, we will do like this, and then we will open, start the feeding. So we will just wait until it will finish. For example, only 500 ml. So we will wait until the 500 ml finish. So now it's okay. So we will close this one because there's still remaining another 500. And we will again disconnect this one, pinch, disconnect, and then close. So the remaining of this is the 500 ml. We can use it later. So this one, the tip of this, we will close, put the gauze. We will do like this in triangular shape, cover, and then do the plaster. And then remove, put in the fridge, and we can use it later for the next feeding. So this one we will put like this. Here in the butterfly. Yeah, in the butterfly, and then under the cheek of the patient.
Not to cover the eyes, huh?
Yes.
Okay.
Not to cover the eyes of the patient. So now you will hand sanitize. Then after you will go to the patient. If make the patient comfortable. Documentation. You will put the date, the time, and if the patient is tolerated or he feel vomited. And then after this one, you're finished feeding the patient. So you need to throw all the materials, the equipment you are using, into the medical waste.
Okay.
That's it, ma'am.
Very good.
Thank you, ma'am.
Kasi you know what, sabi ko nga sa inyo,